Hey there, this is Dr. Evan Osar, founder of Fitness Education Seminars, the movement-based solution to the healthcare crisis, and author of the Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction. Thank you so much for tuning into this webinar, the anti-stretching solution to chronic tightness. Do you work with clients that have chronic tightness? Do you yourself have chronic tightness and have tried foam rolling, stretching, massage, and even chiropractic to help with the chronic tightness? If so, then this webinar is for you. Before we get started, I just want to have a little disclaimer. If you love stretching and your clients love having you stretch them, and you find that it works, then keep doing it. Don't stop doing something that works. And don't send me any hate mail because you disagree with things that I say in this webinar. Keep an open mind and discover why your clients get tight in the first place, and develop a system that works for you to deal with that tightness that's based upon the principles of why your client gets tight and doesn't just deal with the reaction of why your clients get tight. So let's get started with this webinar. And like I said, all I ask that you do is keep an open mind. So why do we stretch in the first place? Well, we've heard that it prevents injuries. And we'll talk about that and what the research says about that. We are conditioned from the time we're small by our grade school PE teachers, by medical doctors, and by industry experts. And we stretch because it feels good. And this last point, I want to comment on a statement that a very smart person once told me. And he said, just because something feels good doesn't mean it is good. In other words, don't confuse sensation with effectiveness. Just because something feels good doesn't make it effective. And again, we want to make sure that our assessments and the way we look at our clients correlate effectiveness with sensation. Usually if something demonstrates effectiveness through either muscle testing, range of motion, or another functional assessment, and it improves it, then we know and we're pretty confident that it creates the effectiveness that we need in our client. However, if we start to look at the effect of stretching on our clients, we may find that it's not doing what the intended result. We're not getting the intended results. So again, keep an open mind. We'll go on and talk about why clients get tight in the first place. So what is the most common cause of chronic tightness? And as you can tell by this image here, stress is the number one reason we get tight and our clients get tight. We know that when we are under financial stress, emotional stress, physical stress, our body reacts by tightening itself up. And if we can deal with some of these levels of stress through exercise, meditation, eating right, reducing, stress reducing techniques, then we can decrease a lot of the chronic tightness. But what about that everyday tightness or the tightness that's related to a specific region of our body? So what is the second most common cause of tightness? What I want you to think about is, what's your body's reaction when it walks on a slippery floor? When you see that caution wet floor sign in the grocery store or in an airport, what's your reaction? Is it to speed up, to walk faster, to walk tall and confident? Or is it to slow down? Is it to flex and adduct and tighten up your posture and tighten up your muscles a little bit more? We know the latter is our response to walking on a wet surface or an unstable surface. Tightness is your nervous system's reaction to an unstable situation or condition within the musculoskeletal system. So what we want to do is discover why does this happen, and then how do we actually deal with it versus just dealing with the reaction, which is the tightness. What does this tell you when your check engine sign comes in your car? Basically it says there's something wrong with the engine or something going on with the car. And it's our job, or your mechanic's job, to figure out what that is. What are your body's warning signs? Because our body gives us a very similar sort of early warning sign. Oftentimes we ignore this, but the signs are there. So what are the three primary signs that something's happening dysfunctionally in our body? Well, we can get pain. That's a pretty obvious sign. Pain is always the sign that something is going on. We may get instability. We may pick that up through range of motion, muscle testing, or our functional assessments. And of course, tightness. Tightness is really your body's early warning sign that something is going on. Doesn't mean, hey, you know what, I better stop and just lay down on the ground, start breathing and meditating. No, no, no. What it tells us is there's something going on, and it's our job as fitness professionals to figure out what that is so that we can help our clients create a new sense of stability. So what are the 3 problems with stretching? So why am I saying the title of this webinar, The Anti-Stretching Solution? Why is there even a problem with stretching? We've been stretching for many, many years and decades, and from the time of man first started walking on the earth, there's probably some stretching. So what are the 3 problems? Well, one is intent, one is inhibition, and one is injury. So let's take a look at those. Intent. Are you stretching where you want to stretch? If you tie 2 TheraBands together, a thin one and a thick one, and you pull on them, which one pulls first? Well, if you know in this image here, the yellow band will pull first, and that would indicate that it's lighter than the blue resistance. Now think about when we have a tight muscle. So let's take a hamstrings, for example. When this gentleman is trying to stretch his short, tight hamstrings, which muscle, so let's just say that's the blue band, and let's say his back is the yellow band. Which muscle stretches first and furthest? We know that's going to be the yellow band, his back. His back will stretch way further, first and further, than his hamstrings. And again, this will create more low back dysfunction and tighter hamstrings. And we'll talk about that in our next webinar on low back pain. So again, one is our intention to stretch what we want to stretch doesn't always work. We often get stretching where we don't intend it, which creates the instability that led to the tightness in the first place. Inhibition. What does the research say? Vertical jump height decreased after static and PNF stretching. So in the Journal of Strength and Conditioning Research, they looked at the effect of static, ballistic, and proprioceptive neuromuscular facilitation stretching on vertical jump performance. And what they found is vertical jump height decreased after static and even PNF stretching. So again, we create muscle inhibition when we statically stretch and or PNF stretch prior to doing a specific movement. We often hear that stretching prevents injuries. But if you look at the research, there's moderate to strong evidence that routine application of static stretching does not reduce overall injury rates. And this is in a journal article that came out on a systematic review into the efficacy of static stretching as part of a warm-up for the prevention of exercise-related injuries. So again, stretching has not been proven in the research to decrease the rates of injury. And just a little bit more on motor control, stretching does not improve motor control. And this comes out of Neurological Rehabilitation by Darcy Umford. Isolated stretching does not result in a lasting improvement in range and may decrease functional ability if not combined with activities designed to increase control. In other words, if you do not improve motor control, you will not create better range of motion in most people, or a range of motion that the person can control. So why do we lose flexibility in the first place? If we understand why we lose flexibility, the solution to chronic tightness will be much more obvious. There's 3 primary causes. One is neurodevelopmental. Voita, which set up a lot of the thought process and concepts of developmental neuromuscular stabilization, or DNS, worked with children, especially children that had cerebral palsy. And what he said is even children that don't have cerebral palsy, or 1/3 of the population, is born with decreased neurodevelopmental ability. So 1/3 of us, and again, it's probably the clients, and when we think about the 1/3 of us, it's probably the clients that are less athletic, in grade school, they'd be picked last on the team. They're a little bit more uncoordinated. They're maybe a little more clumsy than the rest of the kids, maybe not the professional athletes. Doesn't mean there's anything wrong with them, but a third of us, he said, don't develop optimally neurodevelopmentally. Meaning, like, we can do our movement patterns, but they're not always optimal as they should be. And it was an interesting story from a patient of mine. Her son, who's got some musculoskeletal challenges, she told me when he was a small child, he never rolled over. He just really arched his back, similar to this child in this photo, and just sort of kicked himself over. So he had a high level of tone even from that age. And here he is now in his early 20s, and he's and he has pretty significant musculoskeletal problems. So again, we can see the correlation in a lot of, if we were to follow a lot of these children that don't develop optimally, that they're going to develop a lot of the adult onset problems we see in our clients even. And of course, trauma will create tightness, whether it be acute and or repetitive, so like acute injury like from a fall, picking up something wrong. But don't forget repetitive trauma. Working on a keyboard, the sedentary lifestyle will create repetitive injuries to our body and create tightness. Don't forget surgery is trauma. And here's the picture of a 30-year-old male patient who had chronic history of tightness after a L4 laminectomy. So again, complaint of chronic tightness. He was chronically tight through his low back, abdominals, hips, both the flexors and the extensors and the rotators, because his body was trying to stabilize his low back secondary to the surgery. Don't forget we can get trauma in the form of viscerosomatic inhibition, meaning like if we eat inflammatory foods or foods that don't agree with our system and create inflammation, we can shut down the abdominal wall and deep core stabilizers. And again, your body has to compensate and create tightness to compensate for that. And the third category is learned behaviors. Now, when we talk about exercises that create tightness, we can look at a squat, for example, abdominal, leg lowering exercise, and a back extension exercise. And again, the point here is not to say these exercises are good or bad, but just to show you the effect that they have on our system. When this client loads up her back with a barbell, and again, very light barbell for her, but she overextends, overarches her back, and she flexes her lumbar spine. Again, creating stiffness of the thorax and hypermobility of the lumbar spine. In this picture, overdevelopment of your abdominal muscles, especially from doing crunches, leg raises, and exercises like that, will create shortness and stiffness in the abdominal wall and create more instability in the low back, creating tightness. Arching the legs, lifting the legs, doing a back arching exercise. Feel your clients' erectors when they're doing back extensions and or leg extensions. You'll feel huge tone of the erectors, and most of our clients have overactive erectors. They do not need to be doing more of that type of exercises. So again, our exercises can lead to increased tightness. If we look at how a child moves, the child stabilizes around its extremities and moves its limbs around. Moves its trunk around its stationary extremities. And a lot of our bilateral patterns, like barbell squats, for example, make our hips move around a stable trunk. Now, again, not to say that this is a bad exercise, but just to show you the effect it's having on our body. It creates stiffness of our thorax. Pull-ups, same thing. We're moving our trunk around a stationary limb. Creates bilateral extension here. You see a huge extension force through his back. The lats lock down the back. And again, great exercise for developing upper body strength and even core stability. But again, think about the effect it's having on our body. It actually creates stiffness of our thorax. Our aesthetics, what we learn about our bodies. Most overweight people don't walk around with their bellies just hanging out. They pull in. They know we would get taught to suck our abdominals in. And if you look at these fit individuals, it's very easy to see. She's pulling her abs in, creating that flat spine, that very aesthetic look. This gentleman is walking around with a braced up abdominal region. And many of our clients, especially my clients that come into my office with low back pain, they're walking around like this all day long. And gripping can happen anywhere, whether it be the low back, abdominals, hips, even chest. And we'll talk about that more in our next seminar on low back pain. So again, all these things create tightness. And even our cues that we give our clients, tighten your core, squeeze your glutes, pull your shoulder blades down and back, create stiffness and tightness of the shoulder girdle, the trunk, spine, and pelvis. Again, there's times to use these cues, but we need to also teach our clients how to let these cues go, because if they don't, they'll stay in that chronic state of tightness. And this, again, another common cause of chronic tightness. Result, we get thoracic stiffness and cervical and lumbar spine hypermobility, because your body has to make up movement somewhere just to get around life and do functional activities. So the effect of this dysfunction leads to compensatory patterns, respiratory dysfunction, because the more you create locking up of your thorax, the more you have to go into your accessory muscles like your scalenes and pec minors. and it creates hypermobility. And again, a lot of these instabilities we see in our clients are hypermobility instabilities. So we get internal rotation here at the leg. We get over excessive use of her lumbar erectors just when she's trying to do a single leg stance. So a lot of these patterns we see manifest, and we can pick them up during our functional assessments. And what's the myofascial response to this dysfunction? So if you want to think about the myofascial system as a deep system that controls intersegmental motion or motion segment upon segment versus a superficial myofascial system, which is really designed for global stability and global movements of large movements, there's a very significant difference between how they react to dysfunction. The deep myofascial system often becomes inhibited, and we see that in the research, we see it in our clients. We get decreased proprioception, we get decreased movement efficiency, and we get altered motor control. The superficial system becomes overactive. It goes into spasm or muscle guarding, and here's the key thing we mentioned earlier. There's an inability to turn the muscles off. We have to be able to teach our clients not only how to activate the right muscles, but to teach them how to turn those muscles off when they're not needed. And this is why so many of our clients stay in a chronic state of tension. They're unable to turn their muscles off when they do not need them. The inability to turn your muscles off from stress, instability, and cueing leads to gripping syndromes. We have gripping syndromes through the abdominal region, as we discussed before, and here's an example of a client who had a C-section and a GI resection due to scar tissue from her C-section, and she's gripping with her external obliques. This gentleman, again, over gripping with his external obliques to create that lean look. She's over gripping because of her instability created by the abdominal wall being shut down. We have back gripper syndrome. And again, you see this client of mine who's never lifted a weight in his life, and look at the mass of his erector spinae muscles. Look what happens when he goes into single leg stance where he's unstable. Look how much these muscles fire up. Again, this is a client that's never lifted a weight in his life. And you can also see over here where he gets overactive activity of his lats. So he's trying to lock down his shoulders to create stability when he gets onto single leg. Again, this is what's happening to our clients throughout their day. We just don't see it because we often don't see our clients with their shirts off. And I'm not suggesting to have your clients remove their shirts in the gym. I'm just trying to show you what's happening underneath their clothes that we often do not see. And my favorite, the butt grippers. Again, here's a client that came in with sacroiliac joint pain, and you see his deep hollowing because he's a butt gripper, not letting his hips go. And this is a lady that I just saw in the airport. Again, standing in front of me in line, and you see this deep gripping, and she's tucking under because she's over gripping her hips. And again, so many females, especially after surgery, are caught in this hip gripping syndrome. But again, remember, it's not just women, it's also our athletes that we teach them and clients that we teach to over grip their glutes and drive that femoral head forward in the acetabulum. Here's our global gripper, and this guy is just locked down everywhere. He's got his butt gripped under, he's got his erectors gripped, he's got his abdominals gripped, he's got his chest gripped. He's just locked down, and he has chronic low back pain and radicular pain because he's got over gripping. These clients need a strategy to let go. Here's the effects of gripping. Here's why it's so important that we get our clients out of these patterns. You see the overactive lumbar erectors, and then we see this flexion instability. You see this guy over here, he's a fitness professional, overactive erectors, flexion instability. Both these guys have chronic low back pain from over gripping their erectors. This guy is using a slightly different strategy, but the result is the same. It creates flexion instability here and here because of how much gripping they're doing. Here's a short-term effect is we will get lumbar disc herniations, and again, that's what our MRIs show us. But the long-term effect is we start to get bony changes where we start to lose disc space. So here's a normal disc space, a little less disc space, and down here we see almost complete decrease in the disc space and increase in bone density because of this instability. Remember, bone spurs are it's another one of your body's responses to chronic instability. Effects of hip gripping, and again, this slide comes from courtesy of Diane Lee, who's the author of The Pelvic Girdle. He does a lot of work on hip and low back and SI joint dysfunction. And we see that when we overgrip, we drive the femoral head forward in the acetabulum. Again, this is a patient of mine who just had hip surgery for a labral tear, a young patient, 22-year-old baseball player. And we also get femoral acetabular impingement, again, from that forward head position of the femoral head in the acetabulum. We can get adductor and abductor strains because of this dysfunctional decentration of the femoral head, and again, the labral tears as in my patient. Chronic dysfunction and gripping of the hip leads to this. This is another patient of mine who had a C-section, and she's 62 and just had a hip replacement because she's got no cartilage and no joint space left because of long-term hip gripping. So how are we going to deal with this? Well, we're going to look at our principles to improving range of motion without stretching, and it's based upon principles. Principles govern how our body moves. It's not about methods, it's all about the principles. You've heard me talk about them before. Respiration. You must improve your client's breathing before you do anything else. If they're not breathing properly, they're going into their accessory muscles. They're going to make the neck, shoulders, thorax stiff and decrease their ability to stabilize, which creates more compensatory tightness. Second, we must teach our clients how to centrate. When our clients are grippers, like in this image here, we have abdominal gripping, and she's also tucked under here. She's over gripping her gluteals, hip rotators, driving her femoral head forward. We get decentration of the femoral head and an altered and compensatory movement. When we have good centration, the femoral head stays, for example, stays centrated in the acetabulum, and we get good coactivation of all the synergists around the hip joint versus over gripping from the posterior hip that drives the femoral head forward in the socket. Centration, again, is stabilization, the ability to maintain a centrated joint or an optimal axis of rotation, and then dissociate, to be able to move that hip under neuromuscular control. Not just mobility, not just that the joint moves, but that we can control that movement, that we can maintain a long spine in this example and dissociate or move that hip independent of the pelvis without any compensatory motion. Our third principle, integration. When we've respirated properly, breathed properly, get our clients to centrate the joints properly, then we teach them how to combine respiration, centration, and take them into the functional movement patterns of squatting, lunging, pushing, pulling, bending, rotating, and walking. What about yoga? Why does yoga work? Because, again, one of the fundamental things about yoga is you do stretching, and stretching is what increases range of motion. Well, is that really why yoga works? Well, number one, yoga improves people's respiration. It gets them to relax and breathe right. Yoga increases or improves joint centration, just like we talked about a minute ago. It teaches our clients how to line up their body in the right position. Yoga also teaches a client how to breathe right, line their body up right, and take this into fundamental movements of they'll push, pull, squat, lunge, and rotate, as well as bend. So again, yoga is doing the same things we're doing through our principles. And the most important thing that yoga really does for the majority of our clients is it down-regulates the central nervous system. It teaches clients how to calm down, to breathe right, to relax, to get out of a lot of those gripping strategies that we get into because of all the things we talked about: stress, neurodevelopmental reasons, and gripping syndromes. Well, if we look at a comparison of yoga and our integrated movement system, do we both teach respiration? Yes, we do. Do we both teach our clients how to centrate? Yes, we do. Do we both teach our clients how to integrate respiration and centration into fundamental movement patterns? Yes, we do. And do we both down-regulate the CNS? Yes, we do. We do that by teaching our clients how to respirate, centrate, and how to progress appropriately and not just kick their butt because they're coming to us for a workout. So again, you can use your own method and create more range of motion, just like yoga does, by understanding and utilizing the principles of respiration, centration, and integration. What are the take-home keys from this webinar? Number one, understand the CNS response to instability. Our tightness comes from instability. If we want to deal with the tightness, we have to teach our client how to be more stable. Follow the principles. If we teach our clients how to breathe right, how to align their body and centrate their joints, and teach them how to respirate, centrate, and take them into the fundamental movement patterns and progress them appropriately, we will teach our clients how to have increased and improved ranges of motion, and your body will be able to relax and let go some of these chronic gripping and compensatory strategies they're using. And always empower your clients. You already are doing a great job of that. Just remember, for many of our clients, the session they have with us is the most important part of their day. They should leave encouraged, inspired, and with a strategy to improve how their body moves. Don't ever forget, that's our most important role. Keep doing a great job doing what you're doing, working with your clients. If you're looking for further resources, check out Fitness Insider at www.fitnesseducationseminars.com. It's a free newsletter that goes out twice a month, and we have probably over 50 videos on our website, so feel free to check them out. You can have access to all those videos without even signing up for our newsletter, but go ahead, check out our newsletters because we update it every couple weeks and give you free usable content that you can use with your general population clientele. We work with the same clientele you do, the general population, and we'll provide you, our goal is to provide you with up-to-date corrective exercise strategies for training the general population. This is Dr. Evan Nosler of Fitness Education Seminars. I want to thank you for watching this webinar. I hope it served you well in your goal and your role of empowering your clients to be the best that they can be. Take care. Have a great day. We'll catch you next time at Fitness Insider.